We start, though, with a familiar topic, that being the COVID-19 situation here in South Korea. The sharp uptick in daily infections has prompted the country's prime minister to hold an emergency ministerial meeting that happened on Thursday to discuss what authorities here can do in a bid to try and bring this unraveling crisis under control.
For more on this and other related updates, joining us in the studio is a reporter, Shin Ye-eun. Good morning, Ye-eun.
Good morning.
So, Ye-eun, tell us about the caseload for today.
Well, Mok-yeon, today's caseload is expected to reach the 7,000 mark yet again. Up to 9 p.m. on Thursday, we saw the largest figure reported for that period of time at 5,803. The Central Disease Control Headquarters on Thursday said if the pandemic worsens, the country could see up to 9,000 infections per day before the end of this month, and even up to 11,000 cases by early next year. The number of critically ill patients could also reach the 1,000 mark, as Thursday's figures was as high as 857.
Now, as I mentioned before we introduced you, given how severe this situation is now, the Prime Minister convened this emergency meeting on Thursday. What did he have to say?
The Prime Minister Kim Bu-kyum ordered local governments in the Greater Seoul area to upgrade their virus prevention measures to the highest degree. The Prime Minister went on to say that he will be calling President Moon Jae-in every day so that they could together monitor the country's virus prevention measures. He also asked for active participation from civilians, particularly urging the elderly to get their booster shots.
Now, speaking of booster shots, Ye-eun, how is South Korea doing so far in terms of booster shots? Any updates?
Right. The total number of people who have received a booster surpassed 4.8 million. Authorities are currently considering shortening the time frame one can get a booster shot after their primary shots to 3 months. As of now, with the exception of Janssen recipients who can get a booster 2 months after their primary inoculation, most people have had to wait at least 4 months. This includes people aged 60 and up or those at high-risk facilities. Those aged 18 to 59 have had to wait 5 months, and this interval can now be reduced to 3 for everyone eligible, regardless of age. Though we still have to wait and see what authorities decide to do, reducing the interval seems plausible, especially since the European Union's drug regulators cited data saying it's safe and effective to administer boosters as early as 3 months after their initial vaccine completion.
Now, we've been seeing countries around the world stress the importance of vaccinating teenagers as well as adults in a bid to try and bring this pandemic under control. This has been controversial, to say the least. Great many parents, not only here in Korea but around the world, are very reluctant to put this vaccine into their children. How have parents here in South Korea been reacting to this push to vaccinate their teenage children?
As you mentioned, parents in South Korea are also finding this to be very controversial. They're very worried. Authorities, regardless, have urged youths aged 12 to 17 to get vaccinated, especially because they're now making up a bigger portion of infections. From the second week of November to the first week of December, the number of infections per 100,000 was higher for teens than for adults. In a briefing on Thursday, KDCA Chief Chung Eun-kyung addressed the concerns that many students and parents have expressed over the side effects of vaccines. Chung said vaccinated teens were 100% protected from critical illnesses or death from COVID-19, and that's why she urged for more active participation. Take a listen to what she had to say.
In order for our children to safely return to school and for us to continue gradually returning to normal, we ask teens aged 12 to 17 to get vaccinated.
So far, a little over 34% of this age group have been fully vaccinated.
Then, Ye-eun, what are other countries doing to, get more people vaccinated in this age group?
Well, Austria is set on passing a vaccine mandate for people aged 14 and up. If those eligible do not get vaccinated, they will have to pay a fine of a little over $4,000 every 3 months. The unvaccinated will be contacted by a letter as a reminder, and if they fail to get the shot, they will get fined. This measure is still being discussed, but if it does take effect, it is set for February of next year. Over in the U.S., the FDA on Thursday authorized Pfizer vaccine booster shots for 16 and 17-year-olds. Only teens who have received primary Pfizer shots are eligible, though. Mixing and matching vaccines and boosters is not an option, and this move had been reported to be made in consideration of the growing concerns over the Omicron and Delta variant.
All right, Ye-eun, thank you so much for your report throughout the week. Have a great weekend.
Thank you.